Minutes past the hour. Welcome back to JKLIVE here at Citizen Television. We're getting a quicker update on the flooding across the country. Joining us live in the studios is the Secretary General of the Kenya Red Cross, Dr. Ahmed Idris. Dr. thanks so much for your time.
Thank you for having me.
We saw the report earlier on. Yeah. It's looking pretty grave, pretty devastating. Yeah. Give us a quick update.
So look, it's getting difficult. As you said, over 9 counties affected, and we have over 9 counties registered as affected, and we haven't reached the peak of the rain. So we're anticipating that the peak of the rain will be at the end of this month of April, as per the weather forecast from the Kenya Met. So increasingly, there are 4 areas that we are concerned about, not geographically, but in terms of impact. We are concerned about landslides that are affecting areas of central, Marakwet, and some of the highland areas. We are concerned about flash floods in areas where it hasn't rained, but rainfall coming from higher, the highlands and other areas. Likely communities are going to be affected by fast-moving waters. So in Marsabit, Moyale, Garissa, Wajir, and so on. But also we have increasing rise of the lakes in western Kenya, so affecting Busia, Homa Bay, Migori, Kisumu. And finally, the river basin areas, Tana River and Nzoia, again affecting the population in terms of the banks of the rivers breaking and the floodplains, areas affected by the flood increasing. Yeah.
There's been deaths, there's been people displaced. In fact, the number of people displaced is rising now.
Yes. Yeah, so one of the effects of increasing flood waters is more and more people get displaced. And as we said, we're anticipating we will reach the peak of the rainfall, the peak of the floods, and the peak of displacement towards the end of the month. So largely, again, around the areas that I've mentioned, the traditional areas, the wrong word to use, traditional, but these are the same areas that are affected every year. So the Western Basin, the Tana River area, and so on,
Yeah. What are the immediate needs of those displaced right now?
So our priority now is life-saving intervention. So providing shelter, food to persons displaced, access to medication, because, the public health system will be affected by the displacement and the floods itself. So that's essentially our priority area. But second is just immediate search and rescue. So we're getting more and more active with search and rescue. Persons who are affected, cut off from the rest of population, persons who have been washed off by the moving water. So search and rescue using boats and other facilities. But look, Jeff, as I say, what are the immediate needs, life-saving? One of the things that is really important for life-saving for us is just personal choices. Individual decisions. Don't take risks with the waters. So among most of the people who are dying or are getting injured by the waters is because of not just taking personal precaution and safety measures. So you followed recently, yesterday, and persons who were stuck overnight in a bus in the northern part.
Garissa.
Extremely unnecessary. So our request to the general public is be more careful, exercise caution. In the highland areas, we're requesting the public to spend more time assessing and understanding the environment, especially looking at the level of ground, weakness, any potential ground movement, so that we can take precautions rather than regretting later on over loss of lives.
We've also hearing reports of damage to infrastructure, especially in places like Narok and Kisumu. What are you doing to make sure that people have access to safe drinking water?
So we are providing treated water in areas that require treated water. So we have moved all our equipment for the mobile water treatment units in the areas that are likely to be affected and are affected. So we'll be providing a moderate amount of clean and safe water. We're also collaborating with the county governments and the national government around immediate repairs on some of the infrastructure. So that's something that we'll also be working towards. But look, Jeff, in terms of infrastructure, the period between the last rain season and the damage it caused to infrastructure and this season has been too short in terms of recovery, rebuilding, and repair. So it's more difficult in terms of context with the damage in infrastructure.
In fact, some of the displaced people now had just left their IDP camps, right?
Precisely, and that's the sad part about it, is that that populations around Tana River, Western Kenya, populations who are affected in the rain season of October to December, who were in IDP camps, recently left the IDP camps, will unfortunately have to be going back to the same area. So very unfortunate. But our obligation, our effort is to try to make it as bearable as possible so that they have access to the essential services, even in terms of displacement. So we want to put in effort to make displacement as dignified as possible, as unfortunate as it is.
Yeah, shame. Look, with flooding comes waterborne diseases and, of course, malaria. Is that a big problem in these areas that are affected?
Yes, it is a big problem, and the government Ministry of Health is on high alert on these disease outbreaks. We are collaborating around surveillance for waterborne diseases. That's the one that is really critical, so cholera, dysentery. But also there is a process of distributing mosquito nets to as many families as possible, targeting pregnant mothers and children under 5, so that at least we try to reduce chances of increased cases of malaria. So quite a concern. So all in all, it's a multifaceted response to one emergency. So from disease outbreak, search and rescue, to camp management and supporting displaced persons, it is likely at its peak to be a very complex humanitarian operation.
Yeah. The Red Cross has, more than 800 people on the ground right now?
Yes. So
are you also training locals at the same time?
Yeah, so captured by one of the news articles that you started with today, we are working with local community risk reduction teams to get the essential skill sets around safety, around search and rescue. So we're working with communities. But what you have to remember, Jeff, is that we have 250,000 plus volunteers around the country. These are people who are from the community, within the community, and they're the backbone of our response. And so we're working with our volunteers to increase the level of knowledge and awareness at community level, and to be the first level of response in the country.
Yeah, and you're a former volunteer yourself?
Yes, over a long period of time. I think this is going to be my 25th year in the society, both as volunteer and staff, so more or less an old dog in the system.
I hope you learned some new tricks.
Yeah.
Bottom line, what do you tell Kenyans right now who are facing the flooding? We know the rains aren't going to go away for quite a while. What do you tell them?
So look, we can't do anything about the weather, but we can try to make lives as, the impact on their lives as bearable as possible. Definitely there are going to be losses. There are going to be losses on livelihoods. There are going to be losses in terms of infrastructure and property damage. At the end of the day, what we have to remember is that the priority is life-saving. It is to save lives. Take precaution. Don't take risks with your lives. We will be able to work on other measures, including long-term recovery with the community. So our assurance is that both in collaboration with the government at the county level and at the national level, the Kenya Red Cross will put its best foot forward to support communities deal with the current tragic situation.
Absolutely. Dr. Ahmed Idris, Eid Mubarak.
Eid Mubarak to you and also to the viewers around the country.
Thank you very much.
Thank you.
Appreciate your time. You got the update from the Secretary General of the Kenya Red Cross, Dr. Ahmed Idris, telling us the latest. And from one Secretary General to another, Call to Secretary General coming up very shortly on the bench. He has a lot to answer for, and I'm sure you have some questions and comments. Keep them coming. At Konanga Jeff, at Citizen TV Kenya, the hashtag is JKLIVE. JKLIVE takes a break. We'll be back. In the meantime, coming up.